Okay, thank you, Emily. So we've had a few technical issues, but now we're back on. This dog is a bit of a mast cell tumour factory. We've previously removed an anal sac carcinoma from him, as well as a number of mast cell tumours on separate occasions. This is the mast cell tumour of presentation. While clipping, we found this one, which we did an FNA on, and that was also a mast cell tumour. And this one's also come up just as we've been waiting for surgery. So I'm just going to do an excisional biopsy on this one. I'm using proportional margins on this one. So the lesion itself is 6 millimetres, so using 6 or so millimetre margins. Can you also connect this up?
Do you want permission?
Yeah, let's say yes. That'll be a bit quicker after the last experience. So this dog's had always had a pretty good subcutaneous layer of fat. So this is a very superficial tumour, so I'm not going to really go much deeper than this.
Okay.
We probably have a good 2 centimetres of fat here. So I'm not going to get overly aggressive on this. Okay, here's number one.
Let's start closing now.
Yeah, that'd be great, thanks. Got some stitch material there. Okay, so to the next one, which is this one on the inguinal flank fold. These inguinal flank fold ones are always difficult as far as determining what deep margins are, just because they can move around a lot. So mark 2 centimetre margins around that with a sterile marker pen. The mass itself is 2 centimetres as well, so both proportional and metric margins on this one. Pick your preference. It comes out the same. We don't have Eddie on here this week giving us dad jokes.
Yeah, some good ones.
I liked how he's trying to stay as clean as possible.
Yeah.
And struggling.
Yeah, you did.
So we don't really have a deep fascial layer on this one, but we've got a good thickness of subcutaneous tissue, which is not ideal, but it is quite a thick subcutaneous tissue layer, so I think we should be okay with that. Tina, if we don't have 3 extra labels, could you ask for more labels? Skin. So I'm just going to close this one and then we'll move on to the next one. Another packet of 3O nylon, please, Tina. You can just, yeah, thanks. So once we finish closing this one, we'll put away these instruments and use some clean ones and change, well, I'll change gloves. Yeah. Have another 309, please. Yeah. The swaged on part of the suture drill came off the needle. Thanks. Yes. Not on the previous case though.
Okay. And he has 2 incisions?
3.
3. Okay. All in the same area?
Yeah, right hip, right stifle, and we're just about to do right flank.
Okay. Okay. And he's going to have skin sutures?
Yeah.
Okay. Cool. I had pushed him for a bodysuit. Do you think I should take that off? Because the bodysuit, I don't think is going to cover that one.
Bodysuit usually covers that one, wouldn't it?
I think it would. I don't think it'll cover the one you're doing right now.
You could combine with a lick sleeve.
True. Okay.
That's what I ended up doing with Jasper.
Why?
Good.
Oh, because
He's
he's neuter.
neuter as well.
Yeah.
And still he's an idiot.
Do you have any other dogs at home?
What's that?
Do you have any other dogs at home? Just Jasper?
Yeah, I've got it. Another dog and 2 cats. I'm not the best owner.
Why do you say that?
He was running out of the cottage within a week.
Yeah. Jeff did my dog's elbow arthroscopy.
Mm-hmm.
She's recovering a little too well as well. It's hard to keep him quiet.
Yeah. So that we've used, I don't run that too much, but keep that. Can I have it? Yeah, thanks. Thanks. 7, please.
In case no one ever comes.
Well, yeah, we're just changing gloves.
Okay, sorry.
That's okay. Oops. Thanks.
Are you changing gloves also?
He doesn't need to. So we've divided our instruments up into two, so we have separate instruments for the second one, and I'm just changing gloves. It's more of a theoretical concern. I don't think it's really a practical concern, but doing it just in case. So you can either go from most benign to most malignant. If you're dealing with a lipoma first, then you don't really need to change instruments or gloves, which is similar to the last case we did, that we didn't live feed. Or in this particular case, we knew this one is a mast cell tumour, and the next one we're also going to do is a mast cell tumour. So theoretically, we don't want to use the same instruments for both of those. So this is the mast cell tumour here. We've marked 2 centimetre margins around that, and just going to incise around those margins now. Come around that nipple. It's working great. Kind of see how that skin's falling away occasionally. That's why I don't like the debakis or those kind of things for skin, because you end up actually grasping harder and putting more pressure on the skin, and hence more trauma. So yeah, like the rat tooth or Adson's better.
Yeah, the previous surgeon I worked with also had the same opinion.
I don't like him very much, or her. For livers and things like that, they're good, but for skin, I don't really like them. Cautery's not really working great. But it's coming from the side we're resecting, so it should be okay.
Like you scrubbed out.
Mine?
Yeah, just realized what it said.
I think that was Jen that gave it to me. abdomen, we do have typically a fairly good fascial layer, so we'll grab that. Enough 3O monochrome. Need some more. A 2O PDS and a 3O monochrome, please.
Thank you. Are you doing the same your driver's license for this or a different one?
That's fine, yeah. So when this dog first came in, I was very worried about that, but aspirated that as a lipoma, so not a inguinal node. Go through the first exit checklist with me.
Sure, yeah. No box count, post-op analgesic plan, lockdown, ketamine CRI, fentanyl CRI, and that used before we got home. Our fentanyl CRI has about 2.5 hours left. You want to switch on that?
Yes.
Okay. Ready for recovery. We're going to add an additional local block of bacteria mass before we recover.
Yeah.
4 mils of needle paper supplement. I'll check the tail with sharps. And we got 3 samples, the right hip, the right inguinal fold area, and the right lateral abdomen.
Yep.
And we have the all going to be skin sutures.
Yes.
Okay, perfect. And that's kind of it.
Great. So Matteo is just going to close up here, just to use the 2O PDS for the fascial layer. And I'll turn the microphone off, so we'll just do the closure in silence. And then we'll see you for the next 2. So we have another mast cell tumour which may have an axillary flank fold flap if necessary. And then the one after that is another potential maxillectomy in a cat this time. So let's turn the microphone off and we'll see you for the next surgery.